Hi folks, my name is Dr. Mashburn, and today in this video you're going to discover how to get rid of stubborn belly fat. We are certified in what we do. We have even books that we've written about behind the fat diets, and our belly fat program is different from all others, and you'll learn that today. There's a typical weight loss. This is not a typical weight loss program. If you're looking for like packaged foods, Weight Watchers, Jenny Craig, South Beach Diet, Slim Fast, Cabbage Soup Diet, diet pills, etc., exercise 1 hour 3 times a week, counting calories, this video is not for you. All these diets are focusing on the wrong thing. By the way, 97% of you that do these diets gain their weight back, and it's not permanent. You can raise your hand. I know it's happening to you. You'll lose 10 pounds and gain back 15. You'll lose 10 pounds and gain back 10. It's just a yo-yo diet. So the things that worried me may not worry you though, but my clothes wouldn't fit. I didn't want to socialize to be seen in this body. I saw a normal person locked in a fat body when I looked in the mirror. I was ashamed when people looked at me. I didn't feel attractive at all. I still don't feel that way. Withdrew from outside life, exhausted and couldn't sleep. Overweight people dying around me, getting fatter, and health declining, worried about heart attack, stroke, diabetes, cancer. People perceive me as lazy with no self-control. I was the biggest procrastinator around. Many of you have been told, and you've gone to your doctor and they'll say, listen, if you want to get healthy, you've got to lose that weight. Your friends have told you that, and you've heard your doctor say that, but I want to tell you something. It's just the opposite of that. You actually have to get healthy to lose weight. I want to repeat that. You've got to get healthy to lose weight. That's the only thing that's permanent. How many of you know somebody that could eat a big plate of food, and they don't gain 1 pound, and another person eats like a bird, exercises, and gains weight? What's the difference there? There's problem is it's a hormonal imbalance. That's important. That has to be addressed. When you're 20 years old, you can exercise a little bit, diet, and lose the weight. But when you hit 30, 40, 50, 60, 70, it becomes a lot harder to lose the weight because of this hormonal shift. Very important to remember that. Okay, sluggish thyroid accumulates what's called potential energy. What's another name for potential energy? It's fat. So I'm not fat, I've got lots of potential energy. So let me go back to that just a second. Your body will put this fat around the vital organs to protect it if you get sick or something. And so it has to have something to feed off of. So if you're not healthy, if you got high blood pressure, if you got diabetes problems, if you got pain problems, if you got energy problems, fatigue problems, headaches, knee pains, all these things, blood sugar problems, you can't lose weight because your body's going to keep that potential energy there in case it needs it someday. So there's 4 body types also, folks. There's not 3, not 5, but there's 4. The first one is called the adrenal body type. And the arms are normal, the legs are normal, but she has a huge pendulous abdomen here. The next one's the liver type. Everything's normal except a big belly. Then the ovarian type. Everything from the hips up is normal, but the legs, and hips, and the thighs are huge. The next one's the thyroid body type. Big arms, big legs, big belly, everything's big. That's the thyroid type. So you got the adrenal type, the liver type, the ovarian type, and the thyroid type, the 4 body types. And all of you have seen these people walking around. If you go into a ball and kind of watch, you'll see somebody with a big hips. That's an ovarian type. You see somebody skinny legs, skinny arms, big belly. That's an adrenal type. You can pick it out yourself. So talk about the thyroid body type just for a second. The thyroid sits right here in the throat, the thyroid gland right there. Thyroid-related symptoms is weight all over, cholesterol problems, decreased libido, depression with the thyroid body type, brain fog. Like you walk into a room and you go, man, what did I come in here for? I forgot. Cravings of sweets and carbohydrates, craving starches, hair loss, outside 1/3 of the eyebrows, thyroid body type 2. Nail ridges on the fingers, loose skin. This is the goodbye muscle where you wave, and this muscle, this fat flops under your arm right here. That's the thyroid body type. Fatigue, 3 o'clock in the afternoon, you just want to go to sleep. Lastly, cold. Also, you don't have to have all these symptoms. You can have some of these symptoms being a thyroid body type. But the body turns out normal, everything's going good, and you start to gain weight in the arms, belly, and legs. Arms, belly, legs just get bigger and bigger. This is the thyroid body type. How many of you that's listening to this video have some of these thyroid body type symptoms? The adrenal body type, the most important body type we work with, I believe. The adrenal distress, irritable if you're adrenal body type. Pendulous abdomen, sleep problems, facial hair, puffy eyelids, pain, anywhere in the body you have pain, fluid issues, crave salty foods, Can crave chocolate also. Also allergies, autoimmune disorders, high blood pressure, fibromyalgia, out of breath, climbing stairs, adrenal body type. How many of you have some of these symptoms? The adrenal type, everything's normal, legs are normal, arms are normal, belly's normal, and all of a sudden the belly starts getting big. Arms stay the same, legs stay the same, so the belly just starts getting bigger and bigger. That's the adrenal body type. The ovarian body type, all the weight's carried in the hips and the thighs right here. Symptoms of the ovarian body type is menstrual cramps, history of PMS, excessive menstrual bleeding. Ovarian body type also have hot flashes, mood swings, ovarian cyst, pain in the knees, weight gain, hips, thighs, and the buttocks. Ovarian body type starts off normal, and as it goes along, the hips start to get bigger and bigger and bigger. That's the ovarian body type. By the way, there's no men that are ovarian body type. Guess why? Okay. Liver body type, pot belly. There's fluid, a lot of fluid in the abdomen. Right shoulder pain on some of these patients. Finger pain in the morning. Grouchy in the morning. Headaches. Varicose veins. Bloating after eating. Stiffness in the low back and the upper back. Crave fatty food. Love fatty food. Joint problems, pot belly, and skin rashes. Start off normal. Belly gets bigger and bigger and bigger. Looks like there's a basketball in there eventually. How many of you feel like you're a little bit of each body type? You got to get healthy to lose weight. This is important. This lady came in the office. She's over 200 pounds. When she came in, she had symptoms of fatigue, sleep problems, energy problems, headaches, knee pain, constipation, blood sugar problems. She was a miserable person. After 1 month doing everything we asked her to do, I want you guys to guess how much weight she lost. After 1 month doing everything we told her to do, she lost 0. She didn't lose 1 pound in doing everything we told her to do. But all of a sudden, her fatigue started going away. The sleep started coming back normally. Energy started coming back. Headaches were gone. Knee pains, constipation, blood sugar problems started going away. And lo and behold, this lady, after the second month, she had 32 pounds. In the next month, more pounds, because her body is getting healthy and it does not need this potential energy, this fat. It doesn't need it, so it's going to let it go. Shelby B, another patient, 1 year in boot camp, aerobic exercise, 4 to 5 times per week, with a consumption of 1,500 calories per day. Total weight loss in 1 year. How much do you think she lost? 1 year doing this. 0. You know why? She never was told to get healthy to lose weight. She's healthy, unhealthy person, and the body will not let it go. Another lady, 32 pounds. How much weight do you think she lost after 30 days? Doing everything we told her to do. 0 again. We have to get healthy. You have to get healthy. We had to start turning her health around, eating the proper foods to bring her health around. The other things that we have to do. The second month, 29 pounds. After a couple of months, you had accumulation of 40 to 68 pounds lost. Now, this is permanent weight loss. This isn't going to come back because you're getting healthy and your body doesn't need it. It's important to know what's normal to you. It may take a couple of weeks until the body gets healthy enough to start burning fat. Remember the key term, the body gets healthy enough to start burning fat. The maximum fat that can be burned is 4 pounds per week. 5 pounds is absolute highest, 3 pounds is average, and 2 pounds is also common. Many people will lose the initial water first, then they stop because there's no more extra water. They're not losing any more weight. They need to continue to tap into the fat now. That's important. The feedback of getting healthy is increased energy, little or no cravings, better sleep, adequate sleep 7 hours, good digestion, and inches lost, and really starting to feel good. So what's your motivation, folks? Is it your health? Is it your energy? Is it looking good? Most people that I talk to say, Doc, it's every one of those, and that's okay. Why is our program different? No one's evaluating you based on your hormonal influences. We assessed all 6 fat-burning hormones. We're not concerned about calories or fat. We're concerned about stimulating the fat-burning hormones. It's tailor-made to your body type. We look very broadly because the eating less and exercising more is just not the answer. We also help you understand how and why it works. The fat-burning hormones are the growth hormone, insulin growth hormone, the thyroid hormone, the glucagon, adrenaline, and also testosterone. The fat-storing hormones are cortisol, estrogen, and insulin. This is important. We know how to stimulate the fat-burning hormones. We know how to suppress the fat-storing hormones. This is important. This work comes back to the hormonal shift when we're in our 30s, 40s, 50s, 60s, and 70s, and so on. This has to be addressed. Very important. Is there a lack of diet programs or pills out there? No. There's over 39,000 books on Amazon.com designed specifically None is designed specifically for you. And not one of these books, not one has the title, we're going to help you get healthy to lose weight. They don't know that. My weight loss roadblocks, I had cravings, I had confusion, I had no willpower, I was a procrastinator, I was skeptical. You know, what's your biggest challenge with weight loss? People must be treated according to their body type to improve health and have permanent weight loss. That's important.